use for specific, situations you encounter when extracting teeth. So, you may not use all these instruments, but I think it's good to be familiar with them. And then as we progress through other videos and we actually show techniques, it'll be good to see some of these instruments in action so you could actually see what you're going to do with the instruments. All right, so when we're talking about actually cutting tissue, one of the main things you're going to use for this will be the scalpel blade. Now here in front of you, you have two different types of blade handles. The smaller one here is actually a number 3 handle, and the longer one is actually a number 7. Now you can imagine, depending on where you're working in the mouth, it's easier to work with one over the other. The longer one's typically going to be used for more posterior areas of the mouth, so you can get back there a little bit easier. My blade of choice is typically going to be the 15 blade, and that's what I usually prefer for oral surgery. Some people like the 12 blade. Either one's going to be fine. But I typically go with the 15. When you load the blade, you really need to be careful. It's not recommended that you use your fingers, because if you accidentally slip, you could cut yourself. Try to use a needle holder to hold the blade as you place it onto the blade handle, or some other safe method. Typically when you hold this instrument, you're going to hold it in a pin grasp, and you need to be very deliberate when you use this. This is not some kind of instrument you want to just kind of have your hands kind of loosely holding, because this is dangerous. If you drop it on somebody, it could be do a lot of damage. In this situation, we have two of the handles, so a lot of times we'll set up two 15 blades depending on the procedure. If it's going to be a very lengthy procedure, we're going to be doing multiple teeth, it's not a bad idea to have an extra blade handy, because the first one will eventually dull and not cut the tissue as efficiently. So it's good to have a second blade there, so you can have another sharp blade handy when you're actually doing that procedure. Alright, when it comes to actually elevating the flap, typically you have two choices. You can use the Molt 9 periosteal elevator. You'll notice if you look at this instrument, it's kind of sharp, pointed at one end, and there's a broader, flatter end at the other side of the instrument. The point is good for starting the flap. The broad end is really good for like continuing that elevation, but you can also use the point as an elevator as well. I've seen that done before. You actually place this in between the teeth and kind of elevate using this instrument. So it's a pretty handy instrument. This is actually my preference because it's a little beefier, a little easier to hold, and I feel like I can just really do a really good job elevating the flap. The Woodson's another instrument that you could use. This one's a little bit more dainty, kind of in my opinion. It's good for initiating the flap. I personally prefer the Molt 9 though, but I know a lot of perio guys will use the Woodson to elevate flaps. It's definitely a little bit more delicate of an instrument. I don't feel like I can really leverage well with it, so that's why I don't really prefer that one, but certainly an option. Either one of those would work fine. Alright, next we're going to look at instruments that you can use to actually retract tissue. Typically when we think about retracting, we're retracting the cheeks, we're trying to retract the tongue, maybe periosteal flaps. So you have a variety of options. Some of the most common ones would probably be the Minnesota retractors, these two here. These are a little bit bigger and they definitely retract more tissue. Great for cheeks, great for tongues. I definitely use those a fair amount. Some of the other ones would be like the Weider tongue retractor. This one's always kind of interesting. I've also heard it called a sweetheart because it's kind of shaped like a heart. It's very similar to like an Austin retractor. Good for cheeks, tongues, flaps. Sometimes will be serrated on one side to better engage the tongue, and you can actually see the serrations there on that side. So this is really good for retracting the tongue. I know a lot of people, if they're doing sedations, they will use these and kind of just leave them in place for the procedure. The Selden retractor is a little bit thinner. It's definitely got a smoother edge. Sometimes use these for like periosteal flaps. It's not as wide though, so that's one thing I don't like about it. If you compare it to the Minnesota, it's definitely not as wide as the Minnesota, so it's not as user-friendly in my opinion, but certainly not a bad retractor by any means. And then you have the classic, of course, mouth mirror, right? You can retract the tongue, the cheeks with that if you need to. And really, I would say for most surgery purposes, I'm normally using the Minnesota for retracting tissue. Alright, so as far as actually grasping tissue, we have a few choices. One of the most common ones I use is this Adson forceps. This instrument's pretty cool because it's kind of a shorter tissue forceps. Sometimes it'll have teeth at the end, sometimes it will not. but this is really good for suturing. I love to use this as kind of like my second hand when I'm suturing, if I have it. Otherwise, it's really good for just grabbing any type of tissue, flaps, what have you. Another forceps I actually don't have out here. It's called the Stille's forceps. It's a lot longer than, say, the Adson. It's really designed for more posterior regions of the mouth. Of course, you have the cotton forceps or the college forceps. You pretty much use these in any discipline in dentistry. But you can use these for picking up loose tooth fragments, any types of foreign material, getting cotton rolls, that sort of thing. Of course, you have your hemostat. Hemostats, definitely good to know the difference between a hemostat and a needle driver. I will show you a needle driver shortly, but the hemostats can be straight or they can be curved like this one, and they have a locking handle at one end, so you can really use these for a lot of things. One of the main ways that hemostats are used for in a lot of surgical settings is actually clamp like an artery or a vein. Some hemostats have a straight serrated nib, which if you look at this instrument up close, you can see that the surface of that is kind of serrated, right? And the serrations are very straight. And so that's really kind of helps this thing grip whatever you're trying to use it for. Compared to needle holders, the surface here looks a lot different. So it's good to know the difference between those two. You can use these to remove granulation tissue, pick up tooth fragments, foreign bodies, etc. Alright, so next we're going to look at instruments you can use to actually remove bone. Pretty common instrument is the Ron Jor's instrument. This instrument has sharp blades at the end that can be squeezed together. It's got an auto opening feature, so when you close it, it automatically reopens itself. The actual cutting areas, they can be on the side or they can actually be at the end, or it could be both. So typically you're going to use ones that have in-cutting features to place in the socket and to remove like interradicular bone. But you really don't want to use these to remove large amounts of bone. You really want to use these in very small bites. Very delicate instrument. Don't use this to remove a large amount of bone. Of course, we have our burr handpiece. High-speed handpiece. It's high torque. You're going to use sharp carbide burrs with this. You could use a 557, 702, 703, 8 round. A lot of times it comes down to preference. I really like 702s and 703s. But you want to use this to remove bone, especially if you're going to be doing troughing or sectioning of the teeth. Big thing is you need to make sure that the exhaust of this air is not going into the operating field. You really want a rear exhaust on your handpiece so you're not potentially blowing air into the underneath the soft tissue, causing subcutaneous emphysema. Other instruments that we have are the mallet and osteotome. Sometimes people call these the hammer and the chisel. The mallet actually has nylon tips on each side. These are really a shock absorber and a skid protection, so when you're using this it doesn't slide off of the osteotome. Those can actually wear out over time, and so you can order new tips and replace those if necessary. And most of the time, if I was ever going to consider using the mallet and osteotome, would be typically for like a maxillary third molar situation to remove some of the buccal bone to get better access to the tooth. And lastly, we have the bone file, which is a double-ended instrument that you can use to smooth the bone. The particular thing about this instrument is the teeth on this facing here, on that rough surface, really only allows you to remove the bone in a pulling motion. You can't do it in a push stroke. You have to do it in a pull stroke. So when you use that instrument, make sure you're using it correctly to get the most out of that instrument.